Hi, I'm Buffy Trupp, founder of Infertility Insight. Today I'd like to introduce a very special guest, Dr. Collin Smikle, medical director at Laurel Fertility Care in San Francisco, a boutique fertility practice with a highly compassionate and respected medical staff. Dr. Collin Smikle was named as one of the nation's top docs by U.S. News and World Reports and was further defined as the top 1% of his field of specialty, fertility and reproductive medicine. He maintains a 95% and higher rating on sites such as Health Grades and Vitals and sees clients from all around the world in his Bay Area practice. More than any fertility practice I have encountered, Laurel Fertility Care truly balances scientific solutions with personal attention and compassionate care, supporting the body as well as the mind. It's a pleasure to speak with you today, Dr. Smikle. And as an introduction, can you just tell us a little bit about your unique practice?
Well, Buffy, thank you. It has been a while since I saw you, so I definitely appreciate the invitation to come here today. Our practice has been around for the past 8 years, and you are right. We focus our care in providing an environment for patients to get the most supportive environment in going through their journey. Their journey primarily ends when they get pregnant and successfully, and we counsel them throughout that entire process. We do provide the state of the art care, so that may be with all sorts of assisted reproductive technology techniques, from the basic techniques, as in inseminations, to the more advanced techniques such as IVF, ICSI, preimplantation genetic diagnosis, and for those who aren't able to use their own gametes, egg donation or gestational surrogacy if the uterus is needed. So we do provide all aspects of care, and we do focus primarily on managing those patients' expectations because, as you know, not all those processes are successful.
Correct. Yep. Tell us a little bit about your international clientele, because I know you have a really unique international business.
Well, I think a lot of what we did, and I was fortunate to know a number of people who referred patients to us. So we have several physicians from Japan who've been fortunate to refer patients here. We also work with a donor agency that brings patients primarily to our clinic from Japan. We also have worked through some luck with a number of couples from Japan, a number of couples from Israel and from the United Kingdom as well. So our reach is actually pretty extensive given the size and nature of our practice.
Thank you. So, Dr. Smikle, when I was working with you and we were establishing a Mindbody program at Laurel Fertility Care, you were already regarded as a very compassionate reproductive endocrinologist. I was then and I continue to be very inspired by your care for men and women. I know from working with you that you have been a strong advocate for mind-body support. From your scientific perspective, what's the value of offering mind-body support to women and men struggling to conceive?
I'll step back first and talk about some of the things that I think are important in that process. And Buffy, you're right in that the process itself, in terms of trying to conceive, is fraught with a lot of anxiety, a lot of stress, and a lot of frustration. One of the greatest reasons why patients leave the process, leave the endeavor, is that stress. So even if they had unlimited financial resources, many will not pursue the ultimate, their dream, because of the stress and the emotional turmoil they may feel. So I do think that managing that stress, managing those expectations, managing their well-being is integral to their care. And I've thought that throughout my career. I was fortunate when I initially started to work very well with an individual who started me thinking about these modalities, and was encouraged by not only the patient's reduction in stress, but also their improvement in outcome. So that's what motivates me most in considering that this is a strong recommendation to pursue.
Great, thank you. So here's an interesting question. I, like you, often see women who've been trying to conceive for many years, a year and a half, 2 years plus. Some have tried assisted reproduction, some have not. I try and educate people that the type of intervention and work we do at Infertility Insight is an excellent way to begin their fertility process, that the work will help them make better decisions by alleviating that stress, be more innovative and creative with their options. It also gives them tools to cope, like you're saying, with the stress inherent in a fertility process. Essentially, the work removes psychological roadblocks and can really save them time and money. Do you agree that mind-body support is valuable early in the process?
Buffy, I do think that it's a crucial part of the process, and it would be much better served, or patients would be much better served, if they started it well before. And as you know, there are many patients when you were here and part of our program who went through the Mindbody program and succeeded without any other intervention.
Right.
So it's important to realize that the earlier that intervention within their care, the better prepared they are and may actually have success without any further treatment.
Right.
That being said, we realize that patients don't always come with that perspective. Most people look at the treatment well after they need to, but anytime they can actually start accessing those programs, it's going to be valuable. Anytime you can actually have stress reduction, it's going to be valuable. It's harder to say the exact amount that will actually contribute to their success, but we know that it all adds up to having a much, much better outcome. So that's one of the stresses to import.
Great, thank you. Yeah. So do you, in your practice today, is it client by client, case by case perspective when you recommend a mind-body intervention, say?
No, I think we try to be as aggressive as possible in terms of getting patients to consider that. Now, I will tell you that something that's more unique to our situation here is just that in California, this is a mandate to offer, not a mandate to cover states. So therefore, in programs that are on the East Coast where insurance plays a much, much greater role in access to care, it's a much more accepted route to go directly there first. Therefore, patients are very concerned about the cost of these programs. And so even though it's offered, even though it's recommended, many may not seek those services because of the concern about cost.
Yeah.
Now, many may end up spending far more money if they end up having failed cycles and looking back on things. But people will go at their own time and at their own pace.
Of course, and it's hard to know at the beginning, isn't it? Yeah, which intervention will suit each person.
Each person,
Yeah.
exactly.
So I remember not so long ago, really, conducting workshops in your waiting room at Laurel Fertility Care in San Francisco. And since then, really that intervention of doing a workshop really on site has really transformed in that we have this technology now to see many different people from the comfort of their own home. And because this is a intervention that espouses relaxation, slowing down, eating right, all supportive ways to plan your day and sort of take care of yourself while trying to conceive. Being able to offer these workshops where patients can participate from the comfort of their own home seems to be one of the ways that the work is evolving. So I'm just curious, from your perspective, what is the value of online support in the form of workshops and consultations for women and men?
I think that's actually a new and very integral approach in terms of looking at patients and bringing it to their own time. The days when you simply had patients come only during your office hours or
Right.
only to one location is a barrier that provides a lot of obstacles to patients. So clearly, having the means to talk to patients and through a variety of modalities and at their own pace and time is significant. I think more and more programs may look at this modality
Yeah.
to communicate with patients, but it's never going to be something that we can go back to say it's not a significant option.
Correct. Yeah. So, Dr. Smikle, thank you again for taking this time with us today. Really, we look forward to having you participate in our upcoming workshop and for patients to have the opportunity then to ask you very specific questions about assisted reproduction. Your experience and insight are, of course, exceptionally valuable. In an industry where compassion and science often seem at odds, your endorsement is truly compelling and hopefully inspires women and men to pursue mind body support as they create the families they envision.
Well, Buffy, thank you for the invitation, and thank you for at least allowing us to participate. And we look forward to our continued mutual support.
All the best, Colin.
All right, take care now.
Take care.
All right, bye bye.